Good afternoon, everybody. Happy Wednesday. Hope you all having a great day. It's beautiful out now. Get out and enjoy it before the weather changes. Let's see, just had a couple things. Just got an email from a client. So some of these are clients that I've mentioned before, but of course, since it's not May 1st, nobody makes a decision yet. But this is a doctor and his wife, who is also a doctor. And this comes under that Stuff Matters heading. We're trying to, decide between Advantage plans and supplements. But in this particular case, he has an insulin pump, which is up for replacement. And I don't know the life expectancy of these pumps. I believe he said it's about 5 years. So he said, soon he's going to need a new pump. So my question to him was, are you doing it in 21 or 22? Because the pump is quite expensive. With a supplement, the copay, the 20% for durable medical, is covered. With the Advantage plan, it's not. So any savings from an Advantage plan would be wiped out by having to replace the pump this year. So I sent him back and I said, figure out when you're replacing it before we pick a plan, and that way, again, we're maximizing benefit and reducing costs. Other person that I had mentioned previously, she was the one who unfortunately just had her hours cut. So even though she was intending to not be on Medicare yet, she doesn't have much of a choice. They cut her hours and took away her group health. In her case, she's spoken to some friends. They recommended various carriers. I won't mention the carriers by name, but her friends recommended 3 different carriers. Well, in her case, her PCP takes 2 of them. Her specialists, and she has 2, a dermatologist and an ophthalmologist, they each take 1, happens to be the same one in that case, but not the same as the primary takes. So here's the challenge. If she goes with an Advantage plan, she could go with the PPO and see the specialists out of network, which is probably the best thing to do. If she goes with the other Advantage plan that her friends recommended, it's an HMO, no problem seeing the PCP, but she cannot see the other 2 doctors because they are not in the same circle. So again, all these little things matter. Had she just gone with her friend's recommendation, and the third recommendation from her friends, the very well-known carrier, none of the, I'd only checked the PCP. The PCP is not even in it. So either switch doctors, switch plans, find the plan that maximizes the coverage, or go with a supplement and not have to worry about any of this. But, I've got to email her back with what I found and see, how she wants to proceed. But all these little details matter when you're picking a plan. In the case of the doctor with the insulin pump, that's a $2,000 swing either way. If you could save the $2,000, would it be worth having the supplement and paying the fixed cost for the supplement and having that $2,000 covered? There's all these little nuances when you're picking a plan, and that's where we come in. Let's talk. Let's have a conversation. There's never a charge to work with us. We'll gather some information. We'll make some recommendations and do some comparisons, and you decide. So happy to talk it through. Happy to answer anyone's questions. Again, there's never a charge. So just reach out. Phone, email, Facebook, LinkedIn, however's easiest for you, and we can set a time to talk. Thank you very much for listening. Feel free, please, to share this. I get a lot of feedback, people saying they love the videos, and I have no idea if anyone ever watches them. Nobody likes the pages, which would be nice. Just click like. And if they're shared, I don't know. So please do both. Thank you very much for watching, and have a great afternoon. Stay safe and healthy. Take care.